Is it possible to have a negative pregnancy test and still be pregnant?
Hello everyone, and welcome to our discussion today. We are addressing a common question that many women ask: is it possible to have a negative pregnancy test and still be pregnant? It might sound a little complicated, but by the end of this video, you will have a clear understanding.
How do pregnancy tests work?
To understand how a negative result can occur, even when a woman is pregnant, we first need to comprehend how a pregnancy test operates. Pregnancy tests detect a hormone in the body known as human chorionic gonadotropin, HCG. This hormone is only produced when a fertilized egg has implanted in the uterus. Typically, this occurs about 6 days after conception. However, HCG levels are usually too low to detect until after the woman has missed her period.
What causes a negative pregnancy test?
A negative pregnancy test, also known as a false negative, could happen for a few reasons. 1. Testing too early. If you take a pregnancy test too soon after conception, your HCG levels might be too low to be detected. It is generally recommended to wait until after you have missed your period to take a pregnancy test for the most accurate results. 2. Check the test sensitivity. Not all pregnancy tests have the same sensitivity to HCG. Some tests can detect lower levels of HCG than others. So, if your HCG level is low, a less sensitive test might not detect your pregnancy. 3. Test error. It's possible that the test was not conducted correctly. Always follow the instructions on the package, and if the result is negative but you still feel you might be pregnant, consider retaking the test.
So, can you be pregnant with a negative test?
The answer is yes. It is possible to be pregnant even if you have a negative pregnancy test. If you believe you are pregnant but received a negative test result, it is often advised to take another test in a week or consult your doctor. Thank you for joining us in today's discussion. It is certainly possible to have a negative pregnancy test and still be pregnant, often due to testing too early, test sensitivity, or testing errors. As always, if you think you might be pregnant, but your test was negative, and your period hasn't arrived, consider retaking the test or consulting with your healthcare provider. Remember, this video is for informational purposes only and does not replace professional medical advice.